Norovirus, a painful stomach bug, and whooping cough cases just keep rising every year. Data from the CDC shows whooping cough cases are 6 times higher last year, and doctors say they're seeing more serious cases, landing many in the hospital.
Georgia Peck tells us what doctors think could be the reason for this and how you can protect yourself and your family.
COVID is gone, and so it's just human nature that we kind of slack off on doing those things we've learned during the pandemic.
Dr. Randy Del Mundo is an internal medicine doctor with Ochsner in Prairieville. He says we could be seeing such high numbers of the norovirus because we're getting relaxed in proper sanitation practices.
Norovirus is very intimate. You touch it, you put it in your mouth, and you ingest the virus, and it's very, very infectious. Compared to past decades, we have had increase in the norovirus the past 5 years, and trending higher in the whooping cough the last decade.
And for whooping cough, which is a bacterial disease, he says adults aren't getting their routine vaccinations as often as they should. In fact, only 30% of adults report getting vaccinated for it in the last decade, according to the American Lung Association.
Our pediatrician colleagues are very good at vaccinating, and we need to carry that into adult medicine and tell grandma or grandpa, you need to get vaccinated so you don't pass it on to the grandkids.
Dr. Del Mundo says doctors thought only children used to get whooping cough, but now they're seeing older adults catching it and passing it on to their kids, both age groups that are more at risk.
On account of the very young, really don't have a whole lot of buffer, if you will, with health. And of course, the elderly have multiple comorbidities or illnesses. And so, particularly for the norovirus, if you don't watch it, patients get dehydrated easily, go into renal failure, and get hospitalized.
And of course, he says the best way to avoid spreading it to others in your family and to get better faster is to be seen sooner rather than later. Georgia Peck, WAFB 9 News.
Dr. Del Mundo says you can be seen from the comfort of your own home to avoid catching or spreading anything.
And you can schedule virtual visits online at many clinics. You can find a link in our 9 News app. We'll be right back.